Get started?
We are.
Excellent. All right. Welcome, everyone, to another episode of We Good, the virtual town hall on Black Minnesotans, COVID-19, and mental health. I am your host, Brittany Lynch Wright, representing Insight News. This effort is put together through Insight News, the African American Leadership Forum, North Point Health and Wellness, Minnesota Community Care, the Minnesota Spokesman Recorder, and Children's Minnesota. We've all come together to create a biweekly virtual town hall that is discussing the impact of COVID-19 on Black Minnesotans. As we all know, COVID-19 is a public health crisis that's been affecting the mental health of Black Americans across the state, including those who suffer from mental illness, be it depression, anxiety, and other behavioral health disorders. So I do want to make the disclaimer that in this particular moment, we are in a very unique time in history and a very unique time within our community. This conversation on mental health and COVID-19 was scheduled many, many weeks ago. And so what we are doing to honor the global pandemic that is still actively happening, as well as the current crisis of social unrest and racial injustice in America, and specifically within the Twin Cities, we're going to take the first half of this conversation to have our conversation that was originally scheduled addressing mental health as it relates to COVID-19 and Black Minnesotans. And then we will pivot our conversation to address the tragic murder of George Floyd, police brutality, and its impact on our mental health as Black Minnesotans, specifically within the Twin Cities as well as globally. So here to join us for this conversation today, we have our guest healthcare provider, Ms. Adrienne Thornton, who is a nurse/infection preventionist at Children's Minnesota. Welcome, Adrienne. We also have Dr. Lolita King, who is a licensed psychologist. Welcome, Dr. King. Also joining us is Dr. Mike Troy, who is representing Children's Minnesota as the psychologist and medical director for behavioral health services. Welcome to the conversation. We're glad to have you. And last but certainly not least, we have J. Philip Rosier Jr., who is a licensed marriage and family therapist. So welcome. I'm so glad to have all of you here. First, I want to begin the conversation talking and setting the stage for COVID-19 and where we're at currently, especially given everything that's happened over the past 8 or 9 days. I know we haven't had nearly as many news reports on what's happening with COVID-19. So I'm going to refer to Adrienne Thornton. Can you tell us what the numbers are, what the data is showing in regards to COVID-19 and how it's impacting our young people, especially in Minnesota?
Sure. So I want to set the stage because we're so far into this now. If you're like me, you don't know what day of the week it is most days. And so just to kind of set the stage to let people know how long we've been dealing with this. So we realized in late December that China was experiencing issues with COVID. The United States was watching the rest of the world, not realizing that it may have been in our country already, but we were starting to prepare for that. In March, we full on as a state and a country started to seeing COVID and managing it. And so within Minnesota, on March 13th, our Governor Walz, declared a peacetime emergency. And that came with a lot of different recommendations for people to stay home. We started doing fewer elective surgeries. And then on March 15th, he issued the executive order 20-02 for school closures to begin on March 18th. And so with that March 18th date to today, our children have been home, not playing with their friends, not talking to their teachers, not socializing, not getting fresh air, not eating school lunches, not getting the socialization that is really that's the work of children for 77 days. And that is a very long time to be isolated away from your friends and your teachers and your principals and the social workers in the schools that help you deal with everyday life stressors. So just want to set the foundation that we're dealing with 77 days of isolation for our children and young people. So when you're looking at the numbers for today, and this is fresh off of the data field, CDC and MDH update their data every day at 11 o'clock. So I was actually updating my numbers as we were getting ready for this. So this is real-time data as of this morning. We are at over 1,800,000 cases of COVID in the United States and over 105,000 deaths. Of those 1 million cases, about 3% of those are in children 0 to 17 years old. So about 58,000. That's a lot of children that are getting COVID, and oftentimes they're asymptomatic, but we are seeing children get sick from either COVID or the after COVID results with a very rare multi-system inflammatory disease. So that's something to keep in mind. In Minnesota, as of this morning, we are up to 25,000 cases. That's an increase of 300 just from yesterday. So if we increase by 300 cases every day for the rest of this week, we're going to be looking at 2,100 additional cases by Sunday. For deaths, we're up to 1,086, and that's an increase of 14 from yesterday. And so that's 14 people who have lost a loved one, a family member, a mother, a father, a sister, or brother. That's a lot of people to die in just one day. And then when you're looking at our children from 0 to 5 years old, we are up to 480 cases. In comparison, on last Thursday, we were at 369 cases. So we've seen an increase from last Thursday to this Thursday of about 30% just in our children that are 0 to 5 years old. For the older children that are 6 to 19 years old, we're at about 1,800 cases, which is about a 25% increase from last Thursday of 1,400. So we are seeing the numbers go up in our children. So they've been home for 77 days. They're isolated from their friends and their teachers and their principals and everyone else out in the community. And also they're seeing increased numbers of illness in these populations. So that is a concern. And the amount of sickness that they have depends on if they have underlying diseases or other comorbidities. But if you have those, that just compounds the mental health issues that these children are going to experience. So that's just, that lays the foundation to kind of help center everybody on what the problem is and, how we're going to manage it going forward.
Thank you for that. Now, has there been any contact tracing done? Do we know where and why these spikes are happening?
Well, we know that children have historically gotten transmission of COVID from their family members. And so mom has it, she's really ill, she's home, and it's best to social distance and isolate, but who can isolate in their homes? I, for instance, live in a townhouse, and I had a plan that if me or my daughter, got COVID and my special needs son was here, we would lock ourselves in our room, in my room, and stay away from him. But everyone can't do that. If there was 1 or 2 more people living in my home, that would be very difficult to do. And so we know that the kids are being exposed to other adults in the family, and that is how they're getting it. So as we see an increase in the numbers in adults, we're definitely going to see an increase in numbers in kids, especially since they're isolated and having to stay home. And even if you send them outside to play, you can't send them outside to play all day, every day. So if you have an ill adult in the home, you can't really necessarily isolate that adult from the children, and therefore transmission is going to occur.
Got it. And is there are there any recommendations that you have for ways in which we can help our children take preventative measures, whether it is not going to parks and playgrounds or, nutritional intake? What should parents be doing to help prevent either transmission or prevents contraction of the virus in the first place?
Yeah, so it's the same things that we recommend for adults. Social distancing is the most important because if you're not close to a person, transmission is not going to occur. Studies have shown that if you maintain distance, you will not have the COVID transmitted to you. The other thing is, of course, hand hygiene. Hand hygiene is the number one way to prevent transmission of organisms. And whether you do that with an alcohol hand rub or with soap and water, it's very important that children are doing that frequently, especially the little ones who keep their hands in their mouths. And so if you have little ones that are putting their hands in their mouths or they mouth toys, you're going to want to really do soap and water with them, not so much the alcohol hand rub, because it does dry your skin. And if they're sucking on their hands and their fingers, they could very well ingest that. So just keep soap and water. I know everybody was cleaning out the stores of alcohol hand rub, but soap is just as important. So we need to be cleaning the shelves of those as well. And then, if you can get your child to wear a mask, that would be great. If you can't, try to find fun ways to get them to cover their face when you're out in public. So do things like take a fun scarf that they like and make it fun. Let them decorate the mask that they have, on the sides, not in the middle where they breathe, but they could draw on it with markers. They could put little diamonds or something on it just to make it fun. And even with the social distancing, you could add a little math work in there and say, let's count how many steps we are away from everybody and make it a game. And so every time you're out in public, they're counting how many steps they are away from people to maintain that social distancing. And we don't recommend that they go to places like playgrounds and parks where there are lots of people. But if you do take your kids out to those places, just make sure they social distance, wear their face covering of some sort. And if you have alcohol hand rub, take it with you. If you don't, wash your hands with soap and water as soon as you get home. Those are the three main things that will really keep everyone safe, but especially kids, because they tend to be, we like to call them little walking Peachtree dishes, because they carry everything with them. And they don't realize it, they don't do it on purpose, but everything is attracted to children. And so if we keep their hands clean and their faces covered and keep social distance between them and others, then that will go a long way to stopping the transmission.
Got it. Thank you.
Mhm.
I want to talk to Dr. Lolita King. Dr. King, how are you?
I'm doing well. How are you?
I'm fine, thank you.
Good.
All things considered, I appreciate you being here. You are a licensed psychologist, and so I wanted to know if you could speak to the anxiety that people are experiencing, especially Black patients, as it relates to COVID-19. We know that we are disproportionately impacted due to medical access, racial bias, pre-existing conditions, etc. And so this feels in many ways like another attack on Black lives. Can you speak to the anxiety that our community is experiencing and what people can do to mitigate that?
Absolutely. So there are people that have already been identified as having anxiety. And then you add something like this on top of that. So then we're left seeing a lot of our community in crisis even prior to the social unrest that has occurred in the last week. Um, Anxiety typically occurs when people are in the dark about something or the unknown. So it's the fear of the unknown. There, the sense of not being able to control their environments and not having all the information. A lot of times there's misinformation that's given out as well through social media, through the news, or what have you. So with that increase in anxiety, what we are doing is talking to people about just kind of simplifying it. And just as Adrienne was saying, it's simple staying away from people and doing the hand hygiene. And once they realize that that's basically what they need to do and they have control over that, then you can see some of the anxiety kind of dissipating to a certain extent. The other thing is that we've talked about when I've met with people who are coming in related to the pandemic, is the idea that we've gone through this before. You know, the world has seen this before, and we've survived. And just giving that sense of hope that we can manage this in our homes to a certain extent, but there are also families that have multiple families living with them. So you have 2 or 3 generations, or people that are homeless who are, you know, sleeping on couches, and they have to move around. They can't stay there for very long. And then the anxiety that puts on a new family when they go to stay with someone else. And so again, it's just reminding them to decrease the risk of you acquiring it through the hygiene measures.
Got it. Thank you. I want to pivot to Dr. Mike Troy. What are some signs that a young person may be going through a shift in their own mental and emotional health as it relates to COVID-19? Can you speak to the signs, the symptoms, the behavioral shifts that parents should be aware of?
Sure. You know, I think it's important to keep a couple things in mind. One is the kinds of things we would look for and be concerned about under any circumstances. And then the kinds of things that we should be especially concerned and watchful for under this unprecedented pandemic. And, you know, in general, changes in behavior from how things were before. An outgoing kid that becomes withdrawn, you know, a quiet kid that becomes more resistant and oppositional. You know, if you think about it as adults, we can look at one another and say, I'm having a very difficult time. You know, I think it's because of this and that, and I think that's complicating. But if you're 6, you know, you cannot conceptualize it that way and communicate it that way. And so, you know, changes in behaviors will be an indication. I think that as Dr. King was saying, you know, the highest change in mental health problems that are documented so far have been the internalizing kinds of disorders, anxiety and depression, which isn't really too surprising when you think about, you know, kind of this effect of isolation. And, you know, we talk about physical distancing, but of course, and, you know, as been pointed out, you know, there's no upside to social distancing. And so, you know, and people in a lot of circumstances may be, you know, not able to physically distance themselves, but from the point of view of a 7-year-old, it's not the kind of closeness that they need. You know, it's not their classmates, it's not their coaches and their teachers and so on. And so I think that, you know, it's really being aware of what is internal and not just external, and not interpreting the external as necessarily being, you know, a problem, a behavior-based problem, but rather a signal of what's going on internally. And then finally, I just, you know, it's the point is not, you know, original on my part, but, you know, kind of stating the obvious, the capacity for COVID-19 to infect is universal, but the consequences are not. And so everything that was a risk factor before, everything that's associated with poverty, that's associated with lack of opportunity, that's associated with structural racism and the ways in which that affects not just mental health, but physical health and our stress biology, there's nothing about the current circumstances that make that better. It only makes it harder. And so, you know, we need to be aware of all those things and manage problems in the moment. But I think we all need to recognize, what are we going to do on the other side of this? Because there's going to be a tremendous amount of need for mental health services and social support once this is done.
Absolutely.
Sorry, you asked a simple question tonight.
Yeah, of course. You know, it's as simple as it can be, right? And for people who are childcare providers, caretakers, youth educators, youth workers, and extracurricular activities, etc. What is your recommendation on once things do resume or return to our new normal and children are able to leave their homes and be in other people's care? What should these caretakers and these youth workers be anticipating, and how should they, what support would you recommend that they provide?
Well, I'm sure everybody has some thoughts about this. The two things I would say is, one would be to prioritize return to routine. You know, what we long is what we long for what we lost, and so to reestablish, you know, what was there before. And I actually think, just like we will, and Adrienne, before we came on, since Adrienne and I both work at Children's, you know, I said it's good to see you, even if virtually, and we just sort of lamented, you know, kind of what's been lost by not simply being with other people. So not really valuing that as the starting point, and then thinking about now what do we need, you know, to bring kids and teens back onto a healthy developmental trajectory. And in that regard, we have to remember that resilience isn't a moment. It's built over time, and having some faith that all the good work that has been done, you know, by the caregivers and the teachers and the larger holding community, it matters even if people are struggling now. And then resilience is expressed over time, as life begins to return to normal. Kids will return to their healthiest level of functioning as before, if possible.
If possible, right. And it's hard, you know, as our panelists have mentioned, it's hard for adults, so we can only imagine the mental and emotional impact that it's having on our young people, who also may not be able to always articulate the changes and the feelings that they're experiencing. And for this reason, it's creating a really stressful dynamic inside lots of homes right now.
Absolutely.
We know that when the shelter-in-place order went into place, that there were an increase in domestic violence cases. And so I want to ask J. Philip Rosier Jr., who is the licensed marriage and family therapist, are there things that people can be doing to specifically mitigate the stress in their homes, to prevent things from escalating to moments of domestic violence, and how can people maintain happy homes right now?
Yes, that's a good question. The impact on COVID-19 on families is varied, and a lot of it depends on how people, how people negotiate or manage their family lives. It was mentioned earlier about routine. Routine is a very key element. And if you think about it, many people have lost their purpose in a sense. When you lose your job, you lose connection with people. You start to also lose, your purpose. And so this experience can be frightening for some people, but it's also an opportunity. It's an opportunity to redo your constitution, per se, to kind of create your own routine or a new routine that match today's time. And so some of those routines that I think will be helpful for families, I think, is some people have started to take advantage of being home by exercising more. So some people are able to work out, take walks, runs, and also we've watched for those people who are involved in social media, we've watched this growth in the area of social media, and now people are on TikTok and they're doing things like the Savage Challenge together as a family, and some of these other challenges that I think is very important for the cohesiveness of the family. It gives the family something to work together and figure out. And believe me, as a parent, it takes a little longer to learn the new dance moves and the new dance craze. And it's something that your children can teach you And it's a way to connect. Also, of course, we have the traditional family games that, you know, people have played for many years. And so those things offer a space and time for the family to come together in a way that is constructive and meaningful. And then also you need to have some time to yourself. You need to, you know, you think about it, when you're away from work, you're also away from your family. And that's a time where you sometimes are focusing on things outside of your family. And so I think being in the home, it would also be important for you to carve out some time to be in different rooms and focus on things that you might want to enhance in your life, hobbies, kind of invest in yourself. Um, and I think the other piece is staying connected to friends and family, whether it be through, I know that we're kind of tired of Zoom and we're tired of the internet in many different ways. But it also offers us a kind of a lifeline when it comes to staying connected. And so I think it is also important to stay connected to those people that are important to you, so you have someone to talk to in times of crisis.
Excellent, thank you. And if time allows at the end, we're going to ask you to demonstrate some of those TikTok dances you learned so we as a community can come together and learn them. But you brought up something really important. I think the overarching narrative in media and in some probably private conversations as well is this has become hell. Like we're stuck in the house, you don't get a break from your children, it's really hard. But I think it is incredibly important to notice that this is a moment, you know, we may never have this much time together as families in terms of the people that you live with. And so maximizing it and seeing it as an opportunity is an incredibly important mindset shift. So that's a really healthy framework. But I do wonder, in your experience and with in your particular field studying family dynamics, do you think it's necessary for families to have time apart? Is that a critical piece of maintaining a healthy love and a healthy interpersonal relationships, as being able to leave the relationship, even if it's just for 8 hours to go to work and come back? Is that the space and the distance essential, or is it something that's optional that we've just kind of gotten used to?
You know, that's a very interesting question, because I know a lot of it has to do with cultural differences with different people. I know that there's some groups of people that are much more comfortable with being with family, even in times of crisis, and has more of a less, what's the word I'm looking for? Um, they need to interact outside of the family less than some families do. Threshold, that's the word I'm looking for. Some people have a lower threshold for spending time with family. And so I think what's more important is that you take the time to invest in yourself. And so I think what happens when families are stressed and there's lots of conflicts, you have family members that may be devoting so much of their time and energy to the family that they don't have anything left for themselves. And so if you can figure out a way to invest in yourself while you're at home, if that is just, you know, spending an hour on a computer learning a new language, taking an hour away to practice some yoga moves or some yoga positions, or take an hour away to read a book. I think it's important to have some time to invest in yourself. And I think that's what is critical in making sure that there's balance within the family.
Absolutely. So, as it relates to that a little bit, um, families are at home working, many of them at home doing their learning, their distance learning as well. What tips do you have, and this can be to you or to any of the other panelists, to just maintaining a healthy work-life balance? You know, because when the computer in your bedroom becomes your office, it can be kind of hard to pull it away. right? So what recommendations do you have for keeping the balance so you're not just working around the clock?
Yes, yes, that's a good question. And if your computer is in your bedroom, you're already behind the 8 ball. And so I think if you do have your computer in your bedroom, I think it's important to take frequent breaks. I think that's one of the benefits of being at home. You can walk outside the house, get some sunshine. If the work that you're doing is not requiring confidentiality or privacy, I also would suggest maybe taking your computer and going outside on the porch if you have the opportunity to do so. Um, I think creating just new experiences while you're at home helps to kind of keep that balance and keep you from being kind of overwhelmed with work. And then also, I would say, even though you have the opportunity to work until midnight, you have to make sure that you have your routine set to end at a certain time. I think that is key. I think anytime you start to work past your regular time, you're right. Time start to you start to lose track of time, and you're working at all of these different hours, and then you become overwhelmed. So ending at a reasonable time, and making sure that you don't work past those hours, I think is very helpful.
Thank you. Did anyone else want to speak to the work-life balance question before we move forward?
Sure. One of the things that I have encouraged people to do that are working from home is to stay on their regular schedule in terms of getting up, getting dressed for the day. And also, even if you don't have a ideal space, that you do carve out something that you can use that is not involved in like your kitchen table, for example, just a desk and a chair, so that you mentally can disengage and physically disengage when you are done working. I've had some people say, well, I'm at my kitchen table and I just end up sitting there all night because I was working. And then family doesn't know when they can engage with that person or not. So as much as you can, creating some, carve out some space if you can, where it's just going to be your workspace, to reduce the likelihood of burnout and working beyond capacity. And as Phil said, taking breaks. I think it's also important that the children take breaks as well when you're learning, giving them a set schedule. You can go out, take 20 minutes, and so they can come back refreshed.
Thank you. And as we mentioned distance learning, can you provide insight on how parents essentially had to become educators overnight, and that created a significant amount of stress both for the scholar as well as the new teacher / parent. Can you speak to how any recommendations on making sure the relationship stays healthy between parents and child, and eliminating the stress that could come from the sudden change?
Sure. You've raised a really good point and issue. A lot of the moms that I was seeing when it first was mandated that kids stay home and do distance learning, they were really stressed about having to learn all this new technology and get the kid on board to be seated at the time that there's a group meeting or what have you. And I just kind of asked them to just kind of let go of those big, expectations. You only can do what you can do. There were some families that did not have a laptop or did not have the internet. And so, again, we're seeing how, the disenfranchised is further stressed with these kinds of things. They didn't have the best education opportunities to begin with, some students. But then when you add that to it and parents are struggling trying to either work from home or go out and work if they still have a job, then there's all kind of issues that come up with making sure the child has childcare, and as well as being able to log on and complete those assignments. But I tried to express as much as I could that, you only can do what you can do. It's gonna get better. This is just a new skill set that mom or dad is having to pick up in addition to everything else that's going on.
Thank you. I want to ask Dr. Mike Troy, suppose the homeschooling isn't going well. A young person is exhibiting shifts in their mood and mental and emotional state. What services are available given that the pandemic is still happening? What services are available for young people who may be experiencing shifts in their mental and emotional wellness?
Well, in terms of learning, I guess the one point I would make is, and as Lolita was saying, really everybody understanding that we're all doing the best we can with the circumstances that we have. And the challenges that we each face are informed by lots of things, who we are as individuals, what our home life is like, what our jobs are like, what resources we have. And this is not a time to sort of keep pace. It's a time to keep going. And I think kind of being very, not only tolerant, but encouraging of that. And so really cueing off how much can a child do? What can we reasonably get done without it being a battle? I don't know about you folks, but I often say, parenting is not incredibly complicated, but it's very hard. And if you're also the teacher, it doesn't make it easier, and so really adjusting expectations and recognizing that learning happens in a lot of different ways. And the way it's done in a classroom makes sense because it's a classroom. And the way it's done at home may need to look different because it's a home. So having a quite wide sense of tolerance, for that makes sense. In terms of resources, Brittany, I think, this is another place where collectively we need to do the best we can do, and it's not perfect. Children's, like a lot of other community resources for people, have had to convert a lot to telehealth, and they've had to build online resources that are available. And I think most places that have been serving kids and families have stood up online resources for dealing with COVID and for managing these things. And we certainly have at Children's Minnesota, and people can find that online. We're with incredible speed, I would say. We converted almost all of our mental health services to telehealth mental health services. Now, that's good, but this is where I think kind of today's topic is relevant, because one of the great concerns that I have, and that we need to be mindful of, is the ways in which that can simply accentuate the disparities that already existed. And as Lolita was saying, not everybody has Wi-Fi. Not everybody has a laptop. Not everybody has a room where a private therapeutic conversation can occur. And so we do the best we can now, but we cannot lose sight that that is not how we're going to best meet our mission. So there are a lot of telehealth resources available for mental health services. There are at Children's and there are at other places. And so we use that to the extent we can, but in many cases, thinking of it as a bridge rather than a solution.
Got it. Thank you. I want to pivot for a moment back to Adrienne Thornton. As we speak about virtual visits and telehealth, what is the best way if a parent or a young person is concerned that they have contracted COVID-19? Should they schedule a telehealth visit? Should they go directly in? Is it a phone call or an email first based on symptoms? Suppose someone starts feeling ill, it's allergy season. lots of people have been outside for whether it's through protesting or just to get fresh air and be at the park and play. Should they start feeling ill, how do you recommend they go about getting help?
Well, there are many different ways. So if you're symptomatic, if you have any type of symptoms, runny nose, fevers, headaches, um, nausea, diarrhea, lack of taste, loss of smell, any of those symptoms, we always recommend that you call first. One of the ways that we decrease the transmission is by making sure that people who actually have COVID-19 are not exposing others in the healthcare system to it. And so we prefer that you call first, and that's not just for children's. Most hospitals, clinics would want you to call first so that their staff can prepare for your visit. And in some cases, they may even meet you outside of the clinic to make sure you have a mask and you do your hand hygiene, and then they may take you directly to a room. It varies from clinic to clinic and organization to organization, but all organizations have some type of plan in place so that if you call first, you can get evaluated in a timely manner and get tested if you need it. If you don't have symptoms, but you've been exposed to someone that either has symptoms or they have COVID, you may be able to get tested as well. I always tell people to start with their primary care provider. So whatever physician or clinic that you've been going to, I would start there. People can go to the emergency departments. They are all open. They are all accepting patients. But if you have a primary care provider that knows your history, knows what they're dealing with, especially if you have any pre-existing conditions, then it's really recommended that you go to that primary care provider because they will have a better knowledge of what to expect if you do happen to develop COVID symptoms. And then there are lots of places around the cities that are offering testing. There are just testing sites where you can drive up to the testing site, get your swab done, and then drive off and go home. And so the Minnesota Department of Health has some of those listed on their websites, or if you have access to a computer or a phone, just Google Minnesota COVID testing sites, and many of those will pop up. I know that North Point Wellness has one. I don't know the schedule, but if you go to their website, you can find that information. And a lot of the clinics are starting to do it. Fairview has one, Children's has one, but it's only by appointment and only for our patients. And so there are options out there for people, but you will have to do the work to figure out where you can go. But definitely, if you feel like you need to be seen, and even if you develop a symptom that's new, that isn't in that list, but it's new for you and it's different, you've never had it, I would recommend that people call their primary care provider, because what we're finding as we continue to study COVID-19 is that we don't know everything about it. And symptoms are developing as the virus spreads. And so, for instance, initially we were told it was all upper respiratory. And so you would have flu-like symptoms with the runny nose and the cough and the congestion and the fever. And now we're learning that sometimes people don't have any of those symptoms, but they have nausea and vomiting. Sometimes people have none of the nausea, vomiting, or diarrhea, but they have a lack of smell and a lack of taste. And so we're continuing to learn about this disease as it progresses. And so if you have anything that's different in your life in terms of your health and you've never had it and you're not sure about it, call your primary care provider and they can advise you on what you should do next.
Got it. And I do want to say we have Sarah Lubin in the comments who said that North Point does have the Drive Up COVID testing site that's open to the public, as Ms. Adrienne mentioned. And if you would like to schedule your appointment, you can call 612-543-2500. And that's open to the public. I want to go back. Adrienne, you spoke at the beginning of our conversation about symptoms in young people that are mimicking other things. Can you speak to, so it sounds like it could potentially look different in your child, or your child may have symptoms that seem like it's COVID, but it's actually something else. Can you speak to that?
Right. So what we're seeing in children is what we call multi-system inflammatory disease. And so basically it is literally what it sounds like. It is an inflammatory process of the body. And so it's not an inflammatory process that you can see, so you won't necessarily see swelling of the hands and fingers and swelling of the feet that we tend to see with some other diseases. But children start to have different organ systems responding in an inflammatory way. And so we've historically seen this in what we call Kawasaki's disease, and it can impact any of your organs. In Kawasaki's disease, we generally are concerned about its effect on the heart. And so you see an inflammatory process with the heart, which could manifest itself in a number of ways, including hypertension, which is not normal in children, of course, or you can see their cardiac enzymes increasing, or you can see on x-rays and CT scans that the heart itself is actually slightly inflamed. And so what we're finding with children is that this multi-system inflammatory disease occurs after they have had COVID. And so they may not be ill with COVID. They may have COVID and not even know they had it, and then develop these inflammatory processes in their bodies. And so the difference between this and Kawasaki's is that we're seeing this multi-system inflammatory disease impact multiple organs at one time. And so you may have some inflammation of the heart, but you also may have some inflammation of the kidneys, which may manifest itself in having higher concentrations of different lab results from your kidneys. You may have some inflammatory markers in your blood that increase. And so it's just a myriad of different signs and symptoms. And so usually when the kids come in, and for us at Children's, we've seen a lot of children come in with abdominal pain or abdominal swelling. And then we start to evaluate them and realize that they're actually having other symptoms, but this is the one that's manifesting itself to the child and to the family. And so there are more studies being done about this disease, but we are seeing this inflammatory process in children after they've had COVID across the nation. So it's not just in Minnesota, we're seeing it across the nation. And the good news is that treating the inflammatory process that is occurring with either IV inflammatory drugs, or sometimes they get dehydrated and they need IV fluids, the children are able to recover from it. Sometimes it's a short recovery, sometimes it's a longer recovery, but they are recovering from it, which is the good news. What we don't know is what are the extended impacts from this. So for instance, with measles, we are learning that children can recover from measles, but can years later develop a swelling of the brain that can literally kill them. We don't know what to expect from COVID-19 and from this multi-system inflammatory disease development. So we will be monitoring and watching patients and trying to stay on top of what develops as this disease progresses. Like I said, we are still learning about COVID. And I love what my director always says, we are learning how to fly the plane as we fly it, which is not what you want to do, but it's what we're forced to do. And so as new studies come out and new information comes out, we will share it with everyone. And just know that this is ever changing. And as an infection preventionist, I have to tell you, I am one of those people that works a lot of hours. I won't say how many hours I'm working a week, because the therapist on here would probably smack my hand, but I am working a lot of hours. And I have to tell you, my brain sometimes feels like it's going to explode, because the information is changing literally every day. We get new information, new studies, and in order to deal with this, we have to stay on top of it. And so just asking for, the community to have some patience and a little grace with the healthcare workers, because we're doing the best that we can do with the information we have, but the information is changing so rapidly, it sometimes gets really difficult to ingest it and interpret it and then share it with the community in a way that's understandable and that it's really helpful for the community. So, it's happening fast, but we're staying on top of it as much as we can.
Well, we appreciate you taking time to be on this call, and hopefully the numbers of hours you're working will decrease. Do you have a projected timeline of when you'll say, okay, we know COVID now. We know we have a vaccine. We understand it a little bit better, or is it just in the wind at this moment?
It's in the wind, and we have a projected timeline. So everything in infection prevention, we like to say it's not black, it's not white, it's gray, because there is no hard and fast rules when it comes to these things. We are projecting a year and a half to 2 years of dealing with this. It could be shorter, it could be longer. Everything depends on how quickly we can get a vaccine developed and out into the community. Vaccines generally take a year to a year and a half to, develop them, study them, make sure the side effects aren't worse than the treatment. I know that there are some companies out there that are trying to rush this, and I hope that they can, but we have to do that in a safe manner. And so what we're not going to do as a country is rush into using a vaccine that we think may work, but we're not sure. We have to do our due diligence, which is the hard part, because people are saying, well, we know that this probably works. Why don't we just use it? Well, we don't know. We know that it works in some aspect. We don't know the negative impact that may come from using it. And so it could be anywhere from a year to 2 years to we don't know. But I often tell people, this is the new normal. I would just prepare for this to be the new normal, that we are always watching out for each other. We are perhaps not doing as much gathering as we would like to for now. This is your new normal for some time. What time that is, we can't say, but we're going to have to figure out how to operate in this new normal. And I know it's hard. I am a person who loves vacation, and I love the beach. And I try to get a beach trip in at least 2 or 3 times a year. And I haven't had one yet, so I might be a little more irritable than usual. But I am planning to do one in November. I don't know how I'm going to do it because I don't want to get on a plane, but I'm either going to get on a plane with a mask and some hand hygiene, or I'm going to drive 26 hours to Florida to get to my beach and then get in a house that is on the beach away from the rest of the world. And so, you just kind of have to think through it. You're not able to just hop on a plane for $40 each way and just go on a trip anymore. You actually have to plan it out and make sure that you're doing what you need to do to keep you and your family safe. Does that mean we'll be stuck in our houses forever? No. It just means our new normal is more planning and figuring out how to live our lives in a more distant manner, which is unfortunate, but that is our new normal for now.
Thank you for that. Although it's daunting to hear the projected timeline, I too would like a beach vacation. So I'm glad all hopes of traveling are not completely out the window. But we've been focusing a lot on having this conversation about what exactly is happening. And there's a lot of information and it's changing all the time. I want to talk to J. Philip Rosier Jr. and ask, what do you recommend for how families should be talking about the coronavirus? There seems to be, at least within my immediate network, a difference in interpretation. And Ms. Thornton, you may have insight on this as well. But I'm noticing that the people who are like 30 to 40, late 20s, are feeling like they have to parent their parents and educate them and remind them to sit still and to take it seriously, and to parent their children, who are also, for whatever reasons, feeling like, oh, this is a hoax, this isn't real, I just want to go out and live my everyday routine. How should families be talking about COVID-19, and how do we ensure it doesn't become a point of contention?
Well, it's a hard conversation. And I know it because I've had it with several of my family members. And it is, for instance, I'm the baby of 5. And my youngest sister is 6 years older than me. And my brother, who is 10 years older than me, I had to virtually tap him on the hand and say, no, you cannot go visit my nephew, who is your son, who is also an adult, but also has comorbidities. And so and this was earlier in March. So he could not, and he's a health professional, but he could not understand. He's like, well, that's my family. He's my son. Yes, but you all don't live in the same home. And so your exposure is very different from his, and he has comorbidities that make him at higher risk for complications. And so we just have to keep having these conversations, and you have to be honest with people. It is hard. It is not what we want to do, but I always tell people you have two choices. You can choose to live, or you can choose to maybe die. I don't know if you're going to die from COVID. I don't know who's going to die. What I know is that is not a risk that you should be taking with your life or your family's life. And that is the bottom line. We don't know how it's going to impact the people that are exposed to it or that get it. Why would you take that risk? It could be a 50-50 risk. It might be a 70-30. We don't know the risk. Why take it? And so I always, when people, and it happens all the time where people want to debate me. Well, it doesn't matter because we all have it now, and it only impacts the elderly, and it's been here for so long, everyone has it. And that may be true or it may not be true, but why are you going to take the risk? Are you willing to risk someone else's life just because you want to go and have a beer with a friend? It is not worth the risk. And we just have to have these hard conversations with people and be honest that the end result may be death. It may not be death, but it may be. Why risk it? It's to me, it's not worth the risk. And looking at the data that we see coming through every day, we just have to have these hard conversations and be real with our family and friends. For instance, my director has her first grandbaby, and she could not see her grandbaby because of the risk to the baby. Because in the beginning, we were still working in the hospital every day. And as healthcare workers that are working in the hospital, we are at higher risk for transmitting it to someone else. And so it was really hard for her not to see her grandbaby, her brand new, her first grandbaby. But the reality was she may have been an asymptomatic carrier of it. And if she gave it to her grandbaby, would her grandbaby survive and not have problems with it? Perhaps. But perhaps she would get sick and maybe die or have long-lasting health impacts as a result of having COVID. We still don't know what the long-term impacts on your health is if you actually have COVID. You may survive and then have, permanent lung damage or permanent damage to your blood vessels or your heart. We don't know the long-term impacts yet. And so it's not worth the risk. So people have to look at it as a risk benefit. Is what you're planning to do worth the risk of doing that activity? And 9 times out of 10, it won't be. And that's not to say that you can't do something. I have started to socialize more with friends. I have a special needs son who has basically a frail immune system. So he has actually been home since the first week of March. He has not seen another human since the first week of March. And I have started to let people come to my house one at a time. And you have to be asymptomatic, and you have to have not had a fever within the last few hours. And then when they come in, the first thing I do is squirt their hand with alcohol hand rub. And he usually stays in his room, but if he comes down, I make sure that we maintain social distance. But usually I make people visit outside, because the biggest problem with COVID is that if you're in an enclosed space, you're sharing the air, and COVID can get in the air and travel on those air molecules. And so if you're outside, it's not as big of a risk because that's a lot of air. And even if it attaches to those air molecules, it just doesn't get as concentrated or as shared between people. And so if you are really feeling anxiety and you need to be with your friends and family, do it outside and only have a few people. I know the governor said, you could do it with people 10 and less, and that's totally up to you. If you cannot maintain that 6 feet of distance with 10 people, then you should cut it back down to 8. If you can't maintain social distance with 8 people, then you need to cut it back down to 5. But your group size should be determined by how you're able to keep distance from each other and not by how many people you want to be around at the time.
Got it. Thank you. Did anyone else want to speak to how to talk to your family and educate them on COVID-19.
Oh,
All
I
right,
was
so
thinking about,
oh, sorry, go ahead.
I'm sorry.
Okay.
I was thinking,
You can go to leader.
Go ahead, Dr. King.
so I was thinking about the children. They are exposed to so much information, and they pick up on things. So I encourage parents to kind of gauge what the child already knows. So you know, so that you can get an understanding of what they're thinking, what their particular questions are and fears. Um, there is a lot of education that needs to go around in families. Some families might, one member may think that if you have had it or you have antibodies, you can't get it again. You can't be reinfected. There's nowhere in the literature where I've seen that that is true. There are older people that's, and this is, I really don't even want to repeat it, but there was a elder in my church who initially said Black people can't get COVID. And I was really struck by that. And we know that that's not true, clearly, that our rate of infection is probably outpaced of a lot of other communities because of the comorbidity of other underlying health conditions. So I think it's just about having dialogue, re-educating one another. When you find out something new, share that information, allow people to have access to the resources that you have that they may not have, figuring out how to, as a family, check on the elderly, make sure that they are okay, but not going into their homes, for example, 10 deep because you want to see grandma. It's not a good idea. So I think it's just a matter of having constant and open dialogue. There's also been times when I've driven from work and I've seen young people in the park, and there were some young guys playing basketball, and it just my heart dropped because we know that they're sweating, they're touching the ball, they're doing all these things that probably aren't that safe. And then they're going back home. And, you know, as a teen, I don't know how much parents are monitoring their level of practicing good hygiene, but it was very concerning to me to see that. But I think it just takes us as a community, as a family, a whole, to just kind of keep sharing the information, keep making people aware when they're not wearing their mask correctly or what have you. It's going to take all of us in our shared knowledge to help maintain our health in the community.
Thank you. J. Philip Rosier, did you have something you wanted to add to that?
Yes, I have quite a fefew things to add to that. First, Adrian, I am in Florida. I'm about 20 minutes away from the beach. And it was a task to get here. Everybody was masked up. We have disinfectant in our car. We did not talk with people. When I pumped gas, I always had gloves. And then I would spray the gloves down. There's a lot of added steps, but it can be done. So hold out for November. One of the things I think, Lolita, that you talked about at the end was the whole concept of sharing the responsibility of managing COVID-19. And I think that's kind of where you start with the conversation, is that we all are part of this process and we all are responsible for each other. And so I try to make it a family thing. We're responsible for grandma, and we also responsible for little siblings that cannot walk yet. So that way it's more of a shared experience. I also think it's important to talk about the information that we have out there, the stuff that we know. And also I think it's important to say and remind our families that even with the stuff that we know, there's things we don't know. so that we don't get too comfortable with the information that we have. I think one of the biggest things, I think, with talking with family, especially with children, is um, helping them to become part of the process, or helping them to become part of the solution. And so kids are very, very open to activities and feeling responsible and having their own duties. And so one of the things that, I did in my household is I had my son, every time we come in the door, he's responsible for spraying us down. And so kids get excited about having that responsibility. They have a place, or they have kind of a purpose. And talking with kids and reminding them that they can help to curb this disease gives them some agency and helps them to feel like they have some control, even though things are out of control. It reminds them that they do have some control. I think having them, someone be in charge of passing out the masks before people leave, um, having jobs like making sure that there's soap in the bathroom for washing hands, just assigning these little tasks and duties is a way of helping family members, especially children, to be a part of managing COVID-19, not only within the family, but within the community and the global community at large.
Thank you. If you're just tuning in, you're watching We Good, the virtual town hall on Black Minnesotans and COVID-19, and how COVID-19 impacts our mental health. Now, we of course planned this many weeks ago, but given everything that's taken place in the wake of George Floyd's murder, we wanted to create space within our dialogue to honor that this is another global epidemic, or some would even say pandemic, although that may not be the appropriate term medically speaking. But it's something that's happening that by no doubt has significant impact on the way that we live, the way that we operate. It's shifted the way in which people are interacting socially, and it's certainly had an impact on our mental health. So as we pivot, I just want to invite those who are watching to participate. Feel free to ask comments in the chat box, and our moderator will make sure that we see those. Thank you, Alyssa. You're doing an amazing job, by the way, and we appreciate you. So feel free to start asking your questions, and as this conversation pivots, I'll be pulling questions from the audience as well as making space to honor the additional layer that we have of COVID-19 mental health, and now the murder of George Floyd. Something that Ms. Adrienne Thornton spoke of is COVID-19 changes really rapidly. And so for someone like her who works in infection prevention, she is just inundated with information, and sometimes it feels like, man, is my brain gonna explode? Like, how do I possibly process and then educate others on this? And I think that's how a lot of people felt when we first became aware of COVID-19 and the fact that we were in fact in a global pandemic. And now we have all of our news outlets seemingly shifting to the murder of George Floyd, police brutality, and racial injustice. And that's seemingly amplifying on a global level. Can any of you speak to the social, emotional, behavioral, psychological impact of being inundated with all of this trauma, whether it's COVID-19 or the images of George Floyd being killed by Officer Chauvin, or all of the civil unrest that's happened since then? How is this impacting people, and how do we deal with it?
Well, I can tell you, I don't know how it's impacting others. I will tell you how it's impacting me. And I think that it's impacting others in a similar way. So I am old enough to have lived through the Jim Crow era. I'm originally from Georgia. And so I've only been in Minnesota for a little over 22 years, which seems like a long time, but I'm older than I look. But this has caused unknown PTSD for me. As a child, I remember driving through Klan rallies and my mother telling me to get on the floor and don't look up no matter what. And of course, as a precocious child, I did, only to see these strange people with these white hoods on yelling and spewing venom into our car. And my mother trying to quickly drive through that and being scared for my life. I remember driving my oldest sister to college when she went to Fisk, and it was a 6-hour drive from our hometown. And we would pack food as much as possible, but it's a 6-hour ride. But you would have to pick and choose the 1 or 2 restaurants along the way that we could eat at, because even in the 70s, there were restaurants that wouldn't allow Black people. And the ones that didn't necessarily welcome us. And being a child and wondering why these people are being mean to me. And I moved to Minnesota because it appeared to be a better place in terms of race relations for my children. And so I honestly thought I had escaped a lot of what I was living through in Georgia by moving here. And so to have this continue to happen and happen now has been really stressful. I have been a ball of emotions, and I waffle between crying and screaming and laughing. I am glued to CNN all day, which I love CNN, but I have never watched it as much as I watch it now. I am afraid for my children. We live in Rosemont, which has a history of having a lot of people that appreciate and wave the Confederate flag. And when my daughter was in high school, she had to deal with the venom from them. And so I am fearful for my children. I will not let my daughter, who is 20 and very independent, I will not let her out of this house after dark, because I don't know what to expect. We don't know what to expect. And so it's been very stressful, even though we don't have the protest and the rioting that's happening out here. It is still very scary, and I have not slept well since this started. And, I would like to take a vacation, but where am I going to go? I am afraid, I thought, oh, it'd be nice to have a house hidden in the woods up north on the lake. I am afraid that we would get there and get trapped or something would happen to us. And so it has been very stressful. And even I went out on Monday to help with some of the food donations and distributing the food donations. And I was happy to do it. I could not get out of there quick enough, because the closer it got to 5 o'clock in the evening, the more anxious I got, because I felt like I had to get out of the city before anything happened. And so I'm sure that a lot of my brothers and sisters out there are feeling this and dealing with it in the same way. And just know that you're not in it alone. We're all going through this together in different ways, but it is not a happy time right now. It's very unnerving and it is very scary. And, when our president did his speech the other day and he held up the Bible, people decried it and they were like, well, he is, blasphemy against God. And as a person from Georgia who has had to deal with these white supremacy groups all their lives, I saw someone sending a message to his people. And I don't know what that message is. What I know is that they're very organized and they have very covert ways of communicating. And that was his way of communicating with them. And so as a result of that, I now have implemented multiple contingency plans for me and my children. And it was a hard conversation to have with my daughter. Why are we packing backpacks and putting them in the car? But you have to be prepared. We may have to jump in the car at some point and go to a safe haven. And so, I tell people, be prepared. This is a different day and time, and they're much more organized. Groups that are against us are much more organized than they have been in the past. And I'd rather be prepared and nothing happen than not be prepared and have to suffer the brunt of their disdain for us. And so that is where I am. I know that some of my friends I've talked to, and we may get on the phone and just cry, you know, just to have that release. And so I know that a lot of people are experiencing that as well. And, you know, we just have to virtually hold hands and hug each other and help each other make it through this, because it is not going to, it's going to get worse before it gets better. It is.
Well said, and I appreciate you naming the Black migration that many African Americans have participated in, of relocating to Minnesota, thinking that it would be safer than the South. And in fact, George Floyd was in Minnesota for that exact reason. And all of this is now happening because, unfortunately, our great state could not be a safe haven for him. I want to shift to Dr. King. Can you speak to this moment and its impact on you personally or on your field?
Sure. What Adrian talked about in terms of feeling traumatized by what has happened, it just resonated, because what we know about PTSD, post-traumatic stress disorder, or trauma and other related stressor, is that you don't even have to be there physically present when something unexpected, as that video was for a lot of people who just kind of clicked on Facebook and saw it. And you don't have to, it doesn't have to be in your home, or you experience it, like I said, personally, to have this reaction of trauma. And if we look at us as a people, Black community, this is not new to us, but when it happens, it just tears open old wounds. It can kind of make your world kind of confusing. And the thing that I most want to convey is that it is good to have dialogue with one another about this experience. For me, it took 2 days for me to even be able to voice what I was experiencing. And with that being said, I also like to make the point that a lot of times what we're seeing in terms of the aftermath of the protesters, some that did other things other than just being peaceful, and I beg to say that it wasn't all of the Black people that were damaging property, but I think that sometimes we can kind of get distracted in terms of the narrative that the media might put out there. So now it's less about Mr. Floyd's murder, and it's more about, do you see they're tearing up property? And I often say to the people that I am in therapy alongside, I don't see myself as top down, but those people that come to me and I walk with them on part of their journey, there's this understanding that I try to give them to make sense of some of the things that are going on. And that is that if you don't have the language, if you feel powerless, it's going to come out some way. Either it's going to be externalized or internalized. And that may be depression, anxiety, trauma. So it's really complex, and it's very, it's necessary, though, imperative that we try to unpack this for ourselves and for the community as we move through this. The other thing that I wanted to point out was that, you know, there were some people that were being real critical of those that are out protesting and stating, well, they're not social distancing. And I was, you know, my take on it is that there are some things that take precedence over our own oneness or our own humanness when something like that occurs in broad daylight. And so I applaud them for taking that risk with their lives and with their family lives, because although it's not comfortable, although we didn't ask for it, it is now necessary. So I just want to help people not to hold that image that's being perpetrated, that it's about damaging things, but it's about saying, you know, enough is enough in terms of the pain that we have to hold and carry. And that's what I kind of see as what's occurring.
Thank you for sharing that. Dr. Mike Troy, I want to direct one of the questions from the chat box to you. The question was, how do we, in this day and age, educate our young people in words that they will understand about what's happening in today's world? Are you there, Dr. Troy?
Oh, I'm sorry. I'll try to be brief. It's so difficult to speak to these important issues and questions briefly, and it's difficult to both share what one's thinking while also trying to listen carefully. And I'll do the best I can. How to speak to children and young people, I think from the heart, as we've heard so far, because I think the greatest enemy to communication and to helping one another perhaps is less turning a blind eye than is being inauthentic. And so I think if you're talking to people that you care about, like your children, like your family, and you do it with authenticity and honesty, that will matter more than the words. I think that we talk to kids and teens about hard things, other kinds of hard things, other kinds of loss, the death of a loved one or needing to move or something. And by and large, people have a good sense of how to speak in a developmentally appropriate way and in a meaningful way for that individual, and not seeing this terrible tragedy in this moment as fundamentally different, and using those skills that people already have. And then finally, you know, there are many of us that care deeply and work hard on things that are relevant in the general sense, the effects of racism on health and development, how that relates to mental health. And I've been fortunate to work with people at University of Minnesota, at Children's, and at Harvard on these things. But then there's times when that is background and the lived experience is what's urgent and immediate. And I think that recognizing that while there are general things that we should care about and we can contribute to, there's times to stop and to recognize that immediacy, urgency, and power of what's happening in individual people's lives matter more. The other stuff doesn't go away. And so, you know, I think it's a time for some of us to get out of the way to some extent and be ready to work when that time is right.
Thank you. I wanted to ask J. Philip Rozier Jr. the same question. If you care to speak personally or professionally about this moment and its mental and emotional implications.
Yes, it's sad. I was reflecting on that question, and the hard part for me is, even with the number of personal experiences I've had, the experiences I've seen over the years, my fear is that I am growing numb to this experience because it happens so much. Sometimes I have to work hard to connect to the emotional piece of it. And I know that is a reflection upon living in this society, trying to figure out a way to survive in the midst of these experiences or these incidents. There's so many different things that's flying through my mind on so many different levels. I think to just sum this up very quickly, the part that really impacts me, there's two parts to this. One is one of the common themes that these incidents have is the fact that when African-American males are stopped and they are frisked, and many times they're not even questioned, which I find very interesting. in the sense that there is no interest to figure out who we are. It's almost as if we're invisible. And the narrative that law enforcement creates for us is the only narrative. And there is no testing of that narrative. A lot of these situations could have easily been handled if people just ask questions or talk to the people who they are arresting or are interacting with. And I think that's frustrating because people like me are trying to say, hey, this is who I am. And we're having to combat what somebody else want us to be. And that's the part that I think is very painful. And then it triples over into the narrative of our story in general. I think about how the narrative of these incidents was hijacked by Kaepernick kneeling. And I remember all of a sudden we was talking about veterans and all other things outside of this issue. And that's one of, I think, United States gifts is they have a gift to change the narrative, or what we call in politics, I think they call it spin. They can create a spin on almost anything that happens, which complicates the truth. And so because we're not acknowledged, our narrative is not heard, I think these incidents will continue to happen. And the other part I would say around the protesting around this, I think about this from a child perspective. I remember being a kid and being upset about decisions my parents made. And I remember getting so upset that I grabbed my toys and I threw my toys into the wall. I didn't go to my mom's room and throw her stuff around. I threw my stuff around. And there's a reason for that, because I knew that there would be consequences for me going to my mom's room and tearing up her stuff. And I think that's similar to what happens with people of color and people who are oppressed. They have learned that there is a line between what they can do. And I think they're kind of confined, just like a kid is to their room, to when they're upset to attack the things that they have. That being said, I'm also aware that we are in the land of spin and we have to question everything. Who's to say that people in the community are actually burning things? Who's to say that we are actually destroying things? A lot of times people come from other areas and participate in some of those things, and we don't know what is what. And so I think those 2 points are the ones that I just wanted to make. One is that our narrative is never sought out, and we're always misunderstood. And the other is our frustration oftentimes is learned to be contained in the areas that we have been given or we think that we have control over.
Thank you. In the interest of time, I do want to ask one final question, and I'm going to end with Ms. Adrienne Thornton. But before I ask this, I'm just scanning through the comments. I just want to let everyone know that we recognize that there is certainly not enough space and time within the confines of this conversation to fully address the murder of George Floyd and its social, emotional, mental, spiritual, communal impacts. And so we're going to continue this conversation next Wednesday, June 10th. Conversation will be happening via Zoom and Facebook Live, just like this, from 11:30 to 1 p.m. And we'll have some additional panelists joining us. So I want to, if you have to hop off right now, I want to thank you for joining us. But before we officially close, I want to end the conversation with Ms. Adrienne Thornton, who you are an infection preventionist. This moment of COVID-19 is, your work, at all times, but especially right now, And we've all addressed, there are lots of protests happening right now. People are in the streets. Most of them are wearing masks, but some are not. As an infection preventionist, and also as a Black woman who's experienced Jim Crow South, as well as what we're now seeing in many ways as the Jim Crow North, what is your recommendation to our viewing audience on what we do from now until even just next week when we have our next conversation? Should people be participating in protests and food drives and gathering with their family members? Should they stay inside? You mentioned at the beginning of this conversation that the numbers in the state of Minnesota for COVID-19 are continuing to increase. What is your recommendation on how we respond in this moment, given the political climate as well as the global pandemic?
Well, of course, you know, it would be wonderful if we could protest and stay 6 feet apart. That is unrealistic. I was very happy when I saw the protesters starting to wear face masks, because originally I think a lot of them didn't, because it was very reactionary. And so what I tell people, and like I said, I've been out 2 days volunteering, and I'm sure that the people that I volunteer with are ready for me to not volunteer because I drive them crazy. But you just do the best you can do. Everyone should have on a mask. Everyone, you know, as many people as possible, keep alcohol hand rub with you. Because again, if you can clean your hands, because a lot of people don't even realize that they're touching their face as often as they are. And we know that COVID-19 tends to be in the upper respiratory tract to start with. And so making sure that you are cleaning your hands as frequently as possible, making sure that you are staying hydrated. What we're finding with COVID-19 is that there is a lot of blood clotting that is occurring with some of the people. And so if you stay well hydrated, even if you get COVID-19 and you start to have these issues with some of your clotting factors, the more hydrated you are, the better. And so staying hydrated when you're out in this hot sun is very important. I know that Children's is going to be working with the Minnesota Department of Health to implement additional testing sites for people to get tested, because we are well aware that as a result of the protests that we will start to see our numbers go increase exponentially. And so keeping an eye out for Facebook posts and Instagram posts about the additional testing sites so that people can get tested. Because the more we can test, the more we're able to isolate people and perhaps slow down the transmission of the disease. So my recommendation is just do the best you can do, but make sure that you are wearing your face mask or a scarf or over your face, or something that can cover your mouth and your nose, and then that you're doing really good hand hygiene as frequently as possible. That is the best that we can do right now, and then getting tested when you're able.
Thank you. Well, that we are over time at this point, but I want to thank all of our panelists so much for joining us, as well as all of you who stuck around to view this conversation. As I mentioned, next Monday, June 10th, we will continue this conversation on the murder of George Floyd, its impacts on our mental health, and the state of race relations and police brutality in the state of Minnesota, as well as worldwide. So that conversation will be starting at 11:30, and you can follow the African American Leadership Forum on Facebook to view that live stream, or become a part of their email list to be sent the link via Zoom. This conversation was brought to you today through the African American Leadership Forum, Insight News, North Point Health and Wellness, Minnesota Community Care, the Minnesota Spokesman Reporter, and Children's Minnesota. This has been our biweekly virtual town hall called We Good, discussing the impact of COVID-19 on Black Minnesota. My name is Brittany Lynch Wright. Thank you all for your time. Please stay safe. Remember, COVID-19 is real, as is racial injustice in this country, and none of us are immune to any of it. So with that said, God bless, and we'll sign off.